We on? Okay. Well, welcome to all you who may be viewing us and listening. We are pleased to connect with you. It's important that we continue to provide information and hear your thoughts and concerns. I'm State Senator Barbara Favola. I am joined by Delegate Kathleen Murphy, by Libby Garvey, who is chair of the Arlington County Board, and by John Foust, who is a supervisor in the Dranesville area. So thank you to my colleagues and fellow panelists. We all want to extend a big thank you to those essential workers who have made it so easy, if you will, for us to go about our daily business because you were there for us. And by essential workers, we really mean everybody. Those who are delivering our goods and services, those grocery clerks, those waste management experts, those who are doing housekeeping, and those who are doing a range of other things. And then, of course, we have our healthcare professionals and our first responders and our EMS team. We value all of you, and we appreciate what you are doing. Thank you. I have some encouraging news. NoVA has met several very important criteria, and I do want to thank our local leaders for helping us shepherd through this challenging time, Ms. Garvey and Mr. Foust. We have seen a downward trend of positive tests in NoVA over the past 2 weeks, and we've had a downward trend in hospitalizations. So those two criteria were very important to NoVA moving out of phase 0. And we are increasing our capacity for testing. We are increasing our contact tracing, which is absolutely critical. And we're also ensuring that the entire healthcare system is robust enough to continue to move forward. We have enough hospital capacity. We do have enough PPE. And we have ICU beds and ventilators. So that's important, at least at the back end. At the front end, the state has ensured that we'll have enough laboratory capacity to actually handle all the testing that we need to do. So we're moving along in a very deliberate way, and hopefully in a way that is driven by science and facts. So kudos to all of us who are doing our part. Most of you may have read that the governor did sign an Executive Order 63, which will take effect at midnight. And that order will bring Northern Virginia into phase 1. And this decision was made in cooperation with our local leaders and in strong cooperation with our public health leaders in the region. I just will be very brief. This will mean that restaurants can open for outdoor service, and they have 50% capacity. The governor has announced that if you were to go inside a building, you need to wear a mask or a face covering. So it's like I have an important mask, but I also have a face covering. So this could qualify as a face covering. This is really important. In addition to your face covering, we also have to maintain the 6 feet between ourselves and strangers. So that is how we're going to continue to contain the COVID-19 spread, and it's how we will continue to protect each other. So that's really important. And I know, Ms. Garvey, you have a YouTube video on how to make a face mask, and I thought it was pretty on target. So
really simple.
It was very simple. The U.S. Surgeon General has a video on his website on how to make a face mask. So this can be done.
I'm sure mine's more fun.
Yours is more fun. I just want to say that fitness and exercise facilities may only open for outdoor activity, personal care and grooming services. You need an appointment. And you'll have to, again, exercise very important public health measures, wearing a mask and actually adhering to strict safety limits. And at this point, I think I've highlighted the governor's executive order we are happy to, I'm happy to ask my colleagues if they want to give a brief opening remark, or we can go to questions. My Chief of Staff, Julia Chun, will be moderating questions. There are some members of the press on this program. They're listening closely, so we want to ensure that as much accurate information gets out as possible, and it'll give us a sense of what you all think we should be focusing on. So if any of you want to say something, Delegate Murphy?
Yeah, I just want to emphasize that we are grateful for the steady leadership of the governor and appreciate the cooperation and the sharing of info that we have had from our senators and our members of Congress, and especially the cooperation we've gotten from supervisors in looking out for the needs of the community. So I'm looking forward to questions from whoever's on the phone.
Thank you. Chairwoman Garvey.
Thank you. So I guess just quickly, I will say since the beginning, we're starting to pivot our focus a little bit to businesses now, and we've just announced we are covered placards that's going to be out there for all of our businesses, and they will need to sign a pledge that they're going to make sure everybody's wearing face coverings of some sort, that this social distancing, everything that needs to happen. And we're hoping actually that everybody will help self-enforce, if you will, and voluntary compliance is really what we're going to need. But I hope that any business that's not showing that placard, people don't go in. And we're hoping to get our multifamily dwellings to do that as well. I will say quickly what our focus has been from the very beginning here is making sure that our people, everyone in Arlington County, has got a roof over their head, has got food on the table to eat, access to health care if they need it. And also trying to make sure our small businesses survive. So we've got some grant programs, which perhaps we'll get some questions I'm happy to talk about. I too thank the governor for allowing us to take the extra 2 weeks before we got to this phase one. The testing support that we've gotten recently has been helpful, and I hope, Kathleen and Barbara, that you will help Senator and Delegate in Richmond with the governor to make sure that that support for testing continues, because we absolutely need it, and we really just can't do it on our own. It's not going to work. It's got to be statewide and state supported. So I'm happy to talk to you about that offline, but I thought I'd put that plea out there.
No, that's an important request, and we appreciate you've always been very direct and forthcoming in what the jurisdiction needs. So that's great. We're glad to hear it. It's so noted. Supervisor Foust.
Thank you. And thank you for organizing this. It wasn't easy, I'm sure.
It wasn't with all your busy schedules.
We're all getting so good at Zooming. But I wanted to say, first and foremost, that Northern Virginia residents have been amazing through this process. The restraint, and now everywhere you go, everyone's wearing a mask. We're really in this, we really got a sense of community out of this. I'd rather not have had this experience, but I really am proud of the way our community is responding. And I want to say in Fairfax, we were very fortunate to get a large sum of money from the CARES Act.
Right.
And so we've created a couple of programs I hope people will know about, one of which is a small business grant program. Please go on our website, county website, if you have 50 or fewer equivalent full-time employees. Our grant program will open up around 1st of June. We today, an interesting, very interesting development, I think, we passed an emergency ordinance where under phase one, restaurants can have up to 50% of their licensed capacity in terms of seating, but it has to be outside.
That's right.
It can't be inside. So today, Fairfax County passed an ordinance that basically gives the restaurant owner, with the permission of the shopping center owner, the property owner, with his or her permission, they can set up tables out actually on the sidewalks, in the parking lots, as long as they're not, obstructing access or, creating a safety problem. So I think it's going to be very interesting to see how that plays out, and I think people are going to appreciate the opportunity to get out a little bit. So
Yeah, that's a great idea, and other jurisdictions are doing that. So kudos for passing that ordinance. I think that'll be helpful. Okay, we are getting questions through the chat box, but a number of people submitted questions earlier, and I know Julia has organized them. So Julia, why don't you go ahead? Oh, can you unmute yourself?
All right, here we go.
Okay.
We will try to get through these as quickly as possible. So our first question is on the availability of tests for both COVID-19 for those who are asymptomatic and for antibody tests in doctors' offices. Does anybody want to take a stab at that?
I'll take a stab, and then we can, fill in. The state goal is to test 10,000 individuals a day. And actually, the governor recently signed a contract with some pharmaceuticals who are making the tests, the most reliable tests. And we are setting up public testing sites. Some of our healthcare providers are actually setting up drive-through testing sites. The goal is to really expand this to folks who are asymptomatic, and to also ensure that we're picking up individuals who would not necessarily go to get tested. We've got pockets in our community where folks are afraid to go to a healthcare provider. And at these public testing sites, we're locating them in areas that are medically underserved. And there's a no questions asked policy. We're not asking for residency. We're not even asking for address. We're asking for zip codes so we can sort of keep track of where the COVID-19 testing is actually being done. And there's no cost. So we're really expecting that this effort will help us. And more importantly, we're actually doing contact tracing. The state has thus far hired about 400 people, many of whom are in Northern Virginia. We're going to hire another 1,000. It is absolutely critical that we do this contact tracing. And it will enable us to contain the spread of the disease. And but contact tracing is a very challenging thing to do. You have to be culturally sensitive, and actually we've got training for our contact tracers. So if it's something you want to do, go to the Virginia Department of Health website, and you will see it advertised pretty largely. And I do want to say that Arlington has been doing contact tracing pretty regularly, and I think that has been very helpful.
In Fairfax County, we have a website that for COVID-19. It's county's COVID-19 website, but there's a page dedicated to the issues associated with testing. www.fairfaxcounty.gov/health/novel coronavirus/COVID-19 testing. But if you go on, obviously Google it, Fairfax County COVID testing, and you'll get to the page. It's a lot of information, but I'll tell you, my personal opinion is that this is the biggest challenge we have. So many people want to get tested and can't. A lot of it is, still to this day, is limited to those who can, who just display the symptoms.
Yeah.
And can get a doctor to write an order for a test. There is some testing going on that doesn't require that, but the testing capacity, in my opinion, has to be increased dramatically. And that we need to focus on that. The contact tracing, that is, as was explained at the state level, it's going well. Fairfax County today announced a contract where we'll initially, the contractor will be bringing 400 contact tracers to the county. We have contract anticipates that we may require more,
Right.
but that part of it is, I think, going to be okay. It's the failure in the supply chain to deliver the material for testing that I think is just only going to get better as time goes by. You know,
Yeah.
people are catching up with the need, but for now, it's not the best situation.
I agree. We absolutely have to focus on the testing and the contact tracing, and we do need a more robust system, and availability and no questions asked policy needs to be pretty expansive. Julia, do you have other questions?
I just want to mention that Loudoun County is doing a drive-through testing on June 1st, beginning at 10 a.m. At the Philip Bolin Memorial Park in Leesburg. And it's drive-through. So they'll give as many tests as possible until 6 o'clock.
Thank you. And as a follow-up to our last question, other than contacting one's physician, what can you do if you believe you've got the virus or could have the virus and you're asymptomatic?
Call your
Well,
doctor and ask for a test.
it's if you're asymptomatic, but you have reason to believe you may have been exposed, you can go to your doctor and ask for a doctor's order, or you can self-quarantine for 2 weeks. So there are things that there's steps you can take, but we need to get to a point where if people believe that they may have been exposed, they can have access to a test, and we need to get to that point. We're not there yet, but I think that's got to be the goal.
If you're in Arlington, you can call 703-228-7999, 228-7999. And that's our COVID hotline, and you can ask questions. There's a Spanish translation there. And you're right, Barbara, in general, if you're not showing symptoms, but somebody will talk to you and talk you through that. If you do not have a healthcare provider, you can be sent to the Arlington Free Clinic. They can talk it through with you, and the Arlington Free Clinic will give you a prescription and an appointment to get tested at Arlington Mill Community Center. We're doing that every afternoon in the weekdays. So that's available. I absolutely agree with what John said. The testing is crucial, as is the contact tracing. In Arlington, I feel like we're doing pretty well on the contact tracing. We had contact tracers always, and we increased those. And then our manager, we've repurposed about 100 employees to do contact tracing. So we're, rather than hiring outside people, we're using our own people, but we are training them. Anyone, yes, you can go on the VDH website if you want. You can also just Google on Medical Reserve Corps, which is a great way if you want to sign up for the Medical Reserve Corps. You put in your zip code and they send you to us, or wherever your zip code sends you. Right now, you do pretty much have to have a doctor's order. We've all done, John, I know you did in Fairfax, as we did in Arlington. Alexandria did it, as did Loudoun and Prince William. And that was a testing site organized for a lot of people. We did about almost 1,200 people one day, although they filled up pretty quickly.
Great.
And we're asking, again, the governor to do more of that, and that no appointment, no anything else. That's absolutely crucial, and we need more of that, and we don't want to go on the national global market to bid for testing. I think I'm repeating myself, but I might say it again. It's crucial.
That's exactly right. And the state can actually leverage incredible purchasing power.
Exactly.
Barbara. And we will be doing that.
Yeah.
And it would be great if the federal government had a plan.
Well, they're
actually leverage federal power, but we all know where that is at the moment.
Right.
Yes, Julia?
Thank you, Chair Garvey. And I'm getting a text in from staff that says the VDH website that Chair Garvey mentioned has a tool called COVIDCHECK, and it allows individuals to check their symptoms, find a test, and get answers. So we will put that URL out there. But our next question is, how long will the state support COVID-19 testing that does not require a doctor's order? would the state be able to support such testing until there is an effective vaccine?
Well, I think I'll allow Delegate Murphy to speak for herself, but until we have a vaccine, my view is we have to continue to do testing. It's one of those necessary elements to ensuring, again, that we can control the spread, especially coupled with contact tracing. So I don't see the testing going away anytime soon. And I believe that would be the position of our health professionals.
I think there are some individuals who are asking whether counties can ask that we remain in phase 0. It's not clear that the numbers of new cases in Northern Virginia are declining, and how can we justify moving into phase 1 given these metrics?
Do you want
We can ask, but that's it. The governor's in charge. So.
Yeah, the mayors and chairs wrote to the governor and told the story that we weren't even close whenever the rest of the state went into phase 1. And as a consequence, the governor made the right decision, in my opinion, to keep us out for at least 2 weeks. And, things have improved over those 2 weeks. We're going into phase 1, not phase 6. So I'm not suggesting that things are perfect, but phase 1 does not involve a whole lot of at-risk type behavior. It's a very slow transition out of phase 0, which is, complete stay at home. So then recently, the chairs and mayors looked at the data and demonstrated to the governor that 4 of the 6 items were improving. Still, I mean, not good news. People are still being hospitalized, still dying, but the numbers were improving. And then the other 2, one of which was, I think, state-provided PPE, and the other one was contact tracing. Are good. Yeah, we see that they are going to get better here shortly. So on that basis, the governor, again, I think, made the right decision. I'm not sure it was an easy decision, but it was, I think, probably the right decision. And so we'll go into phase 1, and we're going to, take it slowly and see how things go. People, I think people can be. I trust people will approach phase 1 as intended, which is slow. So we'll see. And if the numbers go back, I mean, we'll have to reevaluate.
That's right. I would just say that, again, the governor is encouraging caution. He has actually implemented a requirement about wearing a mask or face covering inside a building. He is encouraging employers, where possible, to continue implementing telecommuting. And if employees are brought back to work, the Department of Labor and Industry will be issuing regulations on what will be required to keep employees safe. So we're taking as measured an approach as possible, but on balance, we believe we can move forward if everybody cooperates and still maintain some level of safety. We'll continue to evaluate the data. There was a question about how will the mask requirement be enforced, and that the governor said in his executive order that the enforcement of the mask or face covering would be done by the Department of Public Health, will not be done through our police force. So I think that should put some people at ease. And certainly we expect restaurants and others restaurants, for example, that are opening at 50% capacity with seating outside, will have signs up. And we're hoping that there'll be a lot of voluntary compliance. The goal here is not to penalize people for misbehaving. The goal here is to educate people on how important it is to do the right thing for themselves, for their families, and for their communities. Next question, Julia. She needs to be unmuted.
Yeah, can I add that? I also saw a question go by about will there be criminal enforcement? And I mean, I think your answer implies it, but to say there will not be criminal enforcement.
That's right.
The mask requirement.
Thank you.
But restaurant owners have the right to not let you eat at their restaurant if you won't wear a mask.
And if
Thank
somebody
you.
really flouts the governor's order, like a restaurant with people and stuff, I mean, I don't think anybody wants to use criminal charges, but they are there. Because it's a class 1, I believe.
Yeah, it's class 1 misdemeanor. So that option is there. But again, that's not our intent. And, restaurants today have rules, no shirts, no shoes, no service. So
No mask, no service.
This is going to be sort of in that. And remember, the restaurant, for the most part, they're going to be serving outside. And if they're serving inside, they're at 50% capacity. Go ahead.
Okay. So healthcare providers and essential workers, senior citizens, and their caretakers still don't have enough N95 masks. And there is no way for others who are not in healthcare to buy N95 masks. What can Virginia do to increase the supply in the state, and where can the average citizen find such masks?
It's a state question, I think. We've
It's
tried. We had an order that got intercepted by the federal government at one point, just saying.
I mean, the medical grade masks are being produced now at a much faster rate. According to my notes, the state has entered a contract with 3M, and they are supposedly going to be producing 95 million masks monthly. So we're trying to get those masks produced and distributed to folks who really need them. There was an article in the Washington Post today, the Metro section, about an EMS worker in Rockville who really felt he needed that medical grade mask because he was riding with very sick people in a confined area like the back of an ambulance. And yet we don't really have enough of those masks to go around. So that is something that we need to work on, absolutely.
I will say in Arlington, I believe we have enough for all of our emergency responders and everybody, at least in Arlington. We had quite a cache going into this, and as soon as January, it started being clear what was happening, we started buying. I think some other areas may have done that. So it got closer, as I say, some of the purchases didn't actually come through for us. But at the moment, for those folks, we're really good. And for most of us, these masks, these cloth face coverings, and keep 6 feet apart, you should be fine. Everybody needs to be using these.
And as a follow-up to that question, someone asked if can the Commonwealth work with our economic development agencies from the state or locally so we can manufacture our own masks and PPE and not be dependent on outside sources?
The state is working. Actually, the Virginia Manufacturers Association has put together a PPE sourcing center, and the state has signed a $27 million contract with the Northfield Medical Manufacturing Group. So we're beginning to, I don't want to say beginning, at this point, we're really implementing more aggressively partnerships in state, so we can actually get things produced and distributed quickly.
There are several companies who've had this same revelation, and they're looking into it.
Some of these companies actually are in Norfolk, and they were doing sort of defense type work, and now we've switched them over. It would have been a lot easier if the president had used the Defense Emergency Act or the Defense Production Act sooner, but we are where we are, and so we're moving forward.
Thank you. What are your thoughts on the psychological effects of the downturn in the economy?
Everybody's as depressed as I am.
It's having its effect.
Terrible.
John, I can't hear you.
Well, I'm just saying, across the board, we're all becoming experts in, quote unquote, experts in fields that we never really thought we would be responsible for, I think. But so I am not an expert on this, but I have been reading a lot about it, and the percentage of people who are experiencing depression, mental health issues as a result of this virus, and I'm sure it's because of the economic, it's because of the social separation, it's because people are dying. Mental health is a huge component of this whole thing, and I know Fairfax County Public Schools is focused like a laser on that issue, and will be providing the support to the school population. We all have to provide support to each other, but then second, we also, at the county level, we have to be aware through our community services board and other services that we provide that this virus is having that type of impact, and it is not insignificant. It's broad-based.
And I think there's a lot of economic stress. I mean, people, to some extent, if you're not, and a lot of people in situations, if you're not feeling stressed or anxious or somewhat depressed, you're probably not well, right? I mean, it's a perfectly natural reaction to what's going on. And I think something that we can do, and I know you're doing that in Fairfax as well as much as possible, is providing these supports. So, we are putting a lot of resources into the Arlington Food Assistance Center and associated groups, and start up a whole group on food distribution to try to make sure that everybody's got food that needs it. It is incredible how the community is stepping up. That is actually fairly heartwarming. I'm hoping people are kind of seeing that if you're part of our Arlington community, nobody's going to let you starve, and we're going to make sure you've got a place to live. We're putting a lot of money into Thrive, which is our group that handles rental assistance, and of course we're doing the rental assistance we've always done. So it's going to be long term. It's going to get difficult, but I think the more the communities see us, everybody stepping up to help and get us all through this, the better off we will be. I think some of it actually is just stress I find for myself, and probably those of us on the call, to get just a tiny bit political. If you look at what's happening at the top of this country, we are a ship in a storm and we're rudderless. We have no rudder. We're just floating around. So it's kind of scary to be in that situation, and it's reasonable to be afraid, and hopefully we'll get that straightened out in a while. But this is a very, very difficult time. The silver lining is how much people are pulling together and making new systems and using old systems to help each other, and a sense of community that we're all going to get through this together. And that, as I say, is a silver lining. And I think that's probably keeping some of us together who might not otherwise be. It's really heartwarming to see how people are stepping up.
On my weekly newsletter, I list, we always share updates about mental health resources and provide a list of resources in that newsletter. If you take a look at it, I think it'll be helpful.
There's, and I certainly agree with the comments my colleagues have made. There, many groups are offering counseling to our healthcare professionals and our first responders. I mean, this is almost a situation where many are suffering post-traumatic stress syndrome. They're working so many hours with under very stressful conditions, and in some cases, in some areas, didn't have enough PPE and what they really needed to provide the kind of care that they were trained to provide, and it's taken its toll. So I think there's a real acknowledgement that that sector of our society really will need care, and we need to be there for them. And I think the point made that, people are living in uncertain times, and that is very challenging when you have responsibilities to take care of your family, to keep a roof over your head, and you're suffering an economic downturn, and you don't know how you're going to come out of it. That definitely does cause some mental health issues. I do want to note that Congress is considering a bill that would put a large amount of funding into mental health services directly, but also requiring insurance plans to fund mental health more robustly. And they're also, in that same bill, there would be a federal hotline, and I'm sure it would be sourced out to the states as well, for additional access to mental health services. So it's an issue that has been noted, and hopefully we can weave together a sufficient safety net. But thank you for the question.
Going forward, will there be a different set of health and safety requirements for different types of gatherings, beauty parlors, barber shops, social clubs, where we won't be able to maintain a safe distance?
Well, right now there are a different set of requirements. If you're going into, an establishment for personal grooming, you're being told you have to have an appointment, and it should be a solo. You should be the solo person in there. You need absolutely to be wearing a mask. So those are requirements that are already in effect for the personal grooming aspects. I think this is going to be sort of, let's see what really works, and let's continue to either enhance requirements that we know work or change the requirements.
Okay.
We're going to have
Thank
to
you,
ease
Senator.
our way back into this, really. It's not going to happen overnight.
Yes, thank you. Do counties publish data showing case and hospitalization trends?
Some. We've been using, because we don't have all of the data ourselves. It's getting better. I think the Northern Virginia Regional Commission has got one of the best data dashboards that you can find, and it does do the whole region, and you can break it out by zip code. They use data from VD8, from the Virginia Department of Health. I mean, a lot of the data that we get goes to the data goes to the Virginia Department of Health and then comes back to us. And we're constantly trying to refine it and get more demographic data. But even now, the results of the tests that come back, the positives, for example, 10% of them aren't assigned to a locality. We don't know where they are. So there are a lot of difficulties with the tests, and with our ability to, with the data, and our ability to therefore show that data. But I really would highly recommend the Northern Virginia Regional Commission. Their dashboard's quite good, and that covers the counties.
The Fairfax County Health District that publishes on a daily basis the total cases. When I say health district, that's Fairfax County, I think Fairfax City, and I think Falls Church City. I think that's the Fairfax Health District. But we publish total cases, total hospitalized, the confirmed of the total cases, those that are confirmed, those that are probable. Publish new cases today, each day, and then cumulative of the number of deceased in the district, and the number of hospitalized. So that's updated daily and is available to the Fairfax County Health Department.
Barbara, I saw a question about long-term care facilities. I'd be happy to talk about that just a little bit.
Yeah, do you want to talk about it, Libby? And I'm happy.
Just a little bit,
ahead.
because that's I think one of the things this pandemic is showing are all the gaps that we've got. So when we get through this, we really don't want to go back to where we were before. One of the problems with long-term care facilities, apart, is how much on the edge they are financially. So we're trying to persuade our long-term care facilities that, pay your people enough money that they don't have to work 2 jobs. You've had people going from care facility to care facility carrying the virus back and forth.
Right.
That's terrible. Most long-term care facilities do not have an infection control person on staff. Everyone should be. That's a best practice. Right now in Arlington, our public health department is functioning that way and offering help to every long-term care facility. We cannot demand to go in. They have to request help from us, but we are offering them that. We are sending people in to train folks. What we found was and we're providing PPE to people and the workers there, and we're finding that the workers sometimes don't know how to wear the PPE and how to take it on and take it off. So we're actually providing the training as well. So we're stepping up a lot. But there is a tremendous problem with how the whole system of long-term care is handled. And that's a long-term problem that when we come out the other end, we can't go back to where we were before because it's not working well.
That's absolutely right. I mean, our most vulnerable are in these long-term care facilities. And I know that the state now is making a concerted effort to ensure that all residents in long-term care facilities and employees are tested. And that has to be a bare minimum. We, these are individuals are frail. Many of them have multiple health conditions and they're living in close proximity. And the point you mentioned on the workers, many of whom are working multiple jobs, we absolutely have to take a more aggressive stand in ensuring that our long-term care facilities are managing this disease and caring for the residents and has high quality with a standard that's as high quality as possible. So good question. I know that the lawmakers are continuing to talk to the governor and his team about the long-term care facilities. We are continuing to talk about more transparency in terms of, what long-term care facilities are actually, which ones have cases and how they're being dealt with. So we are aware of this issue and we are working it. And thank you to the person who asked it. There was a question on schools, and I just want to note that the second week of June, I think the week of June 8th, I will have 3 Zoom meetings that week. One with the Fairfax local officials, school board, myself, and I'm sure Delegate Murphy. We'll be talking about schools in Fairfax County. Then I'll have one on Arlington and I'll have one on Loudoun. So we want to hear from our local officials, and I'm sure I'll be able to get some state official to link in on those meetings. So we are going to do a pretty full discussion on schools, where we're going from here, and how we're going to ease back into some kind of instruction in the fall, whether it's online or in person or a combination of both.
There was one question I saw, Barbara, that somebody asked, so children, nobody under 20 apparently has died in Virginia. I don't know if that's true or not, but I think it's important, and this is how a pandemic works, to think about how it works. Children can carry the virus. So you get children all together, maybe they don't get sick, or maybe they get sick but they don't die, although we are seeing really scary stories about a syndrome that some children are dying in New York and some other parts in the world. So basically we don't know much about this virus. But just because somebody they're doing fine, then they all go home and they take the virus with them, and they've got grandparents and parents and aunts and uncles and then those people get sick. So it isn't as simple as just saying, well, children haven't died, so we should all put them in school. It just is. I wish it were, but it's not.
Point well taken.
Senator, do you want me to ask a couple of questions on schools, or do you want to save those for the next discussion in June?
Why don't we save them to the next discussion, because we're going to be doing it quickly, and now that I've got 2 supervisors with me, why don't we stick with some county-oriented questions or NoVA questions in general?
We actually got a lot of this question. Are basketball and tennis courts considered playing fields?
No. Not for this purpose, if that helps. I'm pretty sure that's right.
And
the point is the basketball, you're all in there, you're breathing in everybody's face, right? So And tennis courts, you know, I think you could argue about that one, maybe singles, but basketball courts. And then you've got to monitor it. That's part of the issue with our parks, is the monitoring. Since we started out this program talking about the enforcement and how important that is. And that's one of the things we think about, is can you enforce it? So it's complicated.
Yeah, my understanding, the fields are open as of, I think, tomorrow. In Fairfax County, but it's for unpermitted activity. In other words, those who have permits to use the fields, the big users, the people who would come up with 30 or 40 people, their activities are not allowed. It's the unpermitted. It's the 5 or 6 kids getting together, or adults to kick a soccer ball. That's allowed. The first memo we got from the Park Authority today said that the tennis courts and basketball courts at the schools were going to be open, but then we got a revised memo later in the day, and I haven't had a chance to look into this, that did not say that. It was the exact same memo we previously got with that comment deleted. So I think that in Fairfax County, the tennis courts and basketball courts remain closed.
I think that's probably right, John. We're doing a lot of regional cooperation, and I know our Parks and Rec departments are talking, and I know we're trying to all do the same thing.
Yeah.
That would be very important on an issue like this, so people don't get confused, because our jurisdictions, are adjacent to each other, and people travel. So
I think Delegate Murphy would like to speak, but she's muted.
She's muted.
Sometimes we can do it, and so there we go.
I feel like I'm reborn. No, it was my understanding really that the tennis courts were open. I know that, but I don't know what the plan is and how they expect kids to be able to play together yet. So
I don't think tennis courts are in Arlington, not the public ones.
We also have a question about temperature pre-screenings. Does that sound like a possibility at any government facilities?
I think it's,
or
go
what
ahead.
is
I
it?
talked about that.
Yeah, it's a possibility, but the more I read, temperature screening really doesn't do very much for you. So, I think we're looking at everything. It's one of the tools in the box, but it's not one of your better ones at all. I don't see us opening up. I don't know about you, John, but I don't see us opening up our government facilities, anything like what we used to do, for quite a long time. I will say one of the things we're looking at is actually having our employees come in stretched out over time. So they need to be spaced, and you want to do teams. So maybe we start the workday at 6 in the morning and go till 9 at night. So people can go in portions that way. And maybe we do Saturdays, which might have the added benefit of actually providing better service for our public and doing it more safely, and actually providing more flexibility for our workers. So that's something we're absolutely looking at, so that we can use the building safely. But putting everybody back in just like the old days, I don't see that happening. I don't know about you, John.
Well, we are waiting to hear from the county executive, who is putting together a plan. There's no sense of urgency, I don't think, because we're not gonna start bringing people back on a regular basis anytime soon. I saw a note come across from all of our friends, Sue, who says that they are doing the temperature screening at Fairfax County Circuit Court.
I'm just saying that's fine to do. It is not a panacea.
It's not a be all and end all.
Don't
It's not
feel
going to
safe.
solve your
Don't feel
problem.
safe. Right. Because if they're doing temperature screening, you are not safe. You need to wear this. You need to assume everybody you meet's got COVID, frankly, for a while.
A mask or a face covering. So we
Face
want.
covering. Yeah, that's what I mean. This is just a made thing. It's
Okay.
not, but it helps.
Yeah, that's it. I went into it was a grab and go, the Italian store in Arlington, and they actually monitor ensure that no more than 10 people are in the store at any one time, and they have markers on the floor saying where you can, keeping 6 feet distance. So
so does the Giant.
Yes. Yeah. So I suspect when public buildings really open in full swing, we'll be doing something similar to that. Fortunately, a lot can be done online, but you do have some folks who, don't have access to the internet or may not have a computer. So we have to be available and accessible to everybody in a safe way. And I expect that our local officials are having interesting conversations and science-informed conversations on these topics.
Well, our staff are, and I will, one of the areas that you really do still need to do in person is the mental health therapy. And we are continuing to provide that in person. We've got the separation and doing safety methods, but we are continuing to provide that in person.
Good.
What's the plan if we have a spike in cases 2 to 3 weeks from now?
That's a good question.
Well, I mean, if we have a spike in cases 2 to 3 weeks from now, we have to evaluate why that came about and what we haven't been doing, and we'll have to change ship and maybe retreat and go back to some of the things that we were asked to do under Ground Zero. We simply have to contain we have to contain the spread of this disease for everybody's well-being, and we have to be responsible about it. So I'm expecting our public health folks are going to be monitoring whatever increases in COVID-19 cases may be and where they are, try to figure out why they happened, and we're going to try to implement corrective actions quickly.
That's the point of contact tracing.
Yeah.
But I believe the governor has said if it comes back in force, we go back to phase 0.
I think we'll have to.
And I think, with contact tracing, again, becoming an expert on a subject matter I knew nothing about prior to this COVID-19. But what I'm reading is that in other countries where they're having more success in keeping the numbers down, when they use contact tracing, but then when they tell someone you need to isolate,
they isolate.
They make it possible. It's an extraordinarily sad situation. The impact on the Hispanic community in Northern Virginia is like just off the charts compared to their percentage of population versus their percentage of the virus.
Yeah.
Part of that may be that they can't, they're living in a situation where they're not able to isolate one from the other. We need to take it to the next step, and to make this effective, all this money we're going to spend on the tracing, to make it effective, once you trace it and you found it, you got to do something with it. And letting people, maybe they isolate, but they're living with 7 or 8 people who don't, that's not going to solve our problem. So
we have a lot of empty hotels.
That's
we are
the
using
point.
Using for some people that need to be
We
isolated.
have contracted for 2 or 3 and are looking at more. But that I think is a piece that will really make a dramatic difference once we get all this contact tracing in place and we identify the people who are at risk or have been exposed, and then we make it possible for them to self-isolate.
I know that Mayor Bowser had said she was securing these hotel rooms for many in her city who could not self-isolate. So,
Senator Favola, I need to.
You need to go.
I'm so sorry. Yep, and it's been an honor and a privilege to be here. Great to see you, John, and Delegate Murphy. And I'll, maybe we'll do it again. If you got any questions that come up later that I need to, provide from Arlington, please let me know, and I'll be happy.
We will give you a tape of this. You can put it up on your Facebook. Thank you for joining us.
Take care,
Garvey.
Thank you.
Bye.
Bye-bye.
Okay. We have a question here about driver's licenses. Is there a plan to extend driver's licenses that expire after June 10th?
The governor said that there will be an extension through August, is what I've been told. So the answer is yes. And information will be posted on the site of the Department of Motor Vehicles. I think maybe we just have time for one more question. So I've got 7:57 on my.
Yeah.
Are you okay, Delegate Murphy, Supervisor Foust? One more question, or do you want to wrap it up?
I've got time.
Another question's fine.
Okay, we do have some left. So we've got a specific one to Supervisor Foust about Scotts Run Nature Park and its condition, and what can we do to address the deteriorating situation there.
Yeah. It's a huge problem. Scotts Run is, I'm not sure it's deteriorating, but it is absolutely a desirable place for people to go who have been shut up in their homes all week. And, for the longest time, Fairfax County Park Authority and the National Park Service had all the parking lots closed on the riverfront park. So Scotts Run, Riverbend, and Great Falls, no parking, quote unquote, didn't keep the visitors away. They found places to park. And that's where the problem is right now. As far as I'm concerned, the real problem is that people are parking in extremely dangerous situations along Georgetown Pike.
Right.
They're parking in extremely, I would say, inappropriate places in, private neighborhoods. It's, that is the issue for me at Scotts Run is such an attractive, such a wonderful place, but it does not have the infrastructure to handle the demand that is there for its use. And it's causing dangerous conditions on Georgetown Pike and unacceptable conditions inside the surrounding neighborhoods with respect to people, taking advantage of the neighborhood for their parking and partying and carrying on. So it's going to be a big part of my life, I think, for a while until we get that fixed.
Well, it's great that we ended on a local question.
They're all local.
They're all local. All politics is local. I remember my 14 years on the Arlington County Board. It's amazing. You do amazing work, Supervisor Foust. People don't know that local officials really are take the brunt of everybody's passion and anger and frustration, and hopefully everybody's love as well. So
great job.
Yeah, you've done
I
a great
want to
job.
thank you, Barbara, for doing this. You're always so good about organizing and putting these things together. So thank you so much for including us.
You are welcome, Delegate Murphy. It's always a pleasure.
Julia, I assume, gets a little bit of congratulations.
Oh, yeah, you're great.
It was flawless.
I just have one announcement to make for the Arlingtonians who might be listening. We have a special election July 7th. So now is the time to go to the registrar's site and ask for your absentee ballot. You know that we had the very untimely passing of Eric Gutshaw, who was just a wonderful servant leader here in Arlington. And so there's a seat now vacant on the board. Nobody can fill Eric's shoes, but there is a seat vacant, and that election again is July 7th. So we're encouraging everybody to vote absentee. And effective July 1st, there's no excuse absentee voting because the General Assembly passed that. Remember that, Kathleen? So that's good. And if somebody needs a witness on the absentee ballot, There are a slew of volunteers, either in the registrar's office or the Democratic committees that will, and probably the Republican committees as well, who will find volunteers to be a witness. So don't forget, go to the website, registrar's website, get your request, your actual ballot for the July 7th election, your mail-in ballot, absentee ballot. That's it, and we will be sending out notices about our upcoming meetings on the schools, and that will be the second week in June, and I will try to get either Secretary Atif Carney or one of the deputy secretaries to talk to us. Thank you all.
Thank
Thank
you.
you all.
Thanks so
Thanks,
much.
Barbara.
Thank you.
Sure.
See y'all.